Good morning, good afternoon, good evening. My name is Henrik Schütz. I am chair of the Education Committee for the International Headache Society. It is my great honor to welcome you to this webinar where we introduce and celebrate that we have created a great collaboration between the World Organization of Family Doctors in collaboration with the International Headache Society. We all know that headache is a huge health problem all around the world. We also know that the world needs healthcare professionals. We need to see more patients who suffer from headache. And we also know that general practitioners and family doctors are usually those who meet the headache patients at first, and they can do a lot of things. They can treat and diagnose headache patients. So this initiative is, in my opinion, very important. And I would really like to thank Aino Özke, who took this initiative together with WONCA, and also Christina Tesorelli, the past president of the International Headache Society. Aino has done an amazing job creating this course. She has been so active in trying to connect IHS and WONCA, and I want to congratulate her for that. I'd also like to thank WONCA for doing this collaboration together with the International Headache Society, and I'm happy that today we have Shlomo WONCA, who is the president from WONCA Europe, and we have Mehmet Ungun from WONCA Turkey, and also Nil Tekin from WONCA in Turkey. So it is really with their help that this has been possible. In this webinar, we'll have talks from Rami Berstein, the president of the International Headache Society, and then we'll have Shlomo WONCA, Mario Perez, Mehmet Ungun, Aino Özke, and Nil Tekin, who will give their perspective on this course. We have many participants, and we will have a question and answer session at the end after the talks. So please go to the Q&A function at the bottom of the screen and write questions. That's much better than writing it in the chat, but we'll also pick up questions from the chat. First of all, I'll just show you by sharing the screen. First, how I can enter the course and take the course, and then we'll show a short video which has been created, which will give you an impression of this course that I hope many of you will take. So let me just share the screen. So this is the International Headache Society webpage, IHS-headache.org. You can all go into this. I have not even entered the login as a member, so you can actually, without being a member, you can go into this, and then you can go to the Learning Center, and then you see here that you can enter this joint project WONCA, and then you can start the course. So it's really quite simple to go in and start the course. If you start the course, you can start by taking the first module. Let me now show you a video that illustrates this great course.
The first comprehensive collaboration between IHS and WONCA Europe to raise awareness and update knowledge of headache among GPs. IHS and WONCA Europe e-learning platform. If you work as a GP or family physician, go to the page now. Password is WONCA. Do pre-tests. Learn tips for diagnosing headache in Module 1 from a 10-minute presentation. Do the post-tests, and if you have achieved more than 70% success, Go immediately to Module 2 and learn the secondary causes of headache from a short video after doing the pre-tests in Module 2. If you have passed the post-test, you're ready for Module 3. Answer the pre-tests immediately and learn the current information on the treatment of primary headache in Module 3 from a short video. If you passed the post-tests, you are now a headache-educated family physician. When you have completed the other modules in a similar way, you can print your certificate and share it with pride. For more, don't forget to visit the IHS Learning Centre and follow the IHS and WONCA Europe social media accounts.
Good. So that gave you an impression of how you can take this course. So now it's my honor to introduce the first speaker, Professor Rami Bernstein, who is the current IHS president and is very well known in the headache field for his great research, but also for his activity within the International Headache Society. So thank you so much for being here, Rami Bernstein.
Well, thank you everybody for joining us. I'm Rami Bernstein. I'm the president of the International Headache Society, and I'm not going to take much time, but in a brief few minutes, share with you my vision and concept of why we're doing what we're doing, and how much the International Headache Society is committed to figure out why we are not providing access to headache medicine around the world the way we should. So it took us a long time to understand that there will never be enough headache specialists and enough neurologists to treat the 1 billion people with migraine around the world. Most likely there will never be enough MDs to treat all the people with migraine around the world, but we have to start somewhere. And as we begin to understand that when you have one neurologist over 10 million people in different parts of the world, that neurologists cannot provide the answer to all headache patients, we started to go down the totem pole and understand who are the people who can see or who see most migraine patients, and actually went through medical school and have proper medical education to diagnose and treat migraine. So along this line, we define two different aspects of access to headache medicine. The first one is education, and the second one is the price of medication. We are all aware of the fact that most people around the world cannot afford current migraine medication, even medication that are found on the essential medication list of the WHO, and that it is the responsibility of the International Headache Society and nobody else to negotiate correctly and make headache medicine affordable by government, by healthcare professionals, and by patients who should be able to get it regardless of whether they're rich or poor. The second task of it is education. And it's not the first time we are starting. We have been challenged by attracting physicians outside the field of neurology and headache medicine to spend the right amount of time and to both to learn and to see long enough to diagnose migraine patients. Along this line, we are launching every possible program to try to provide the minimum amount of education that will allow primary care physician to diagnose both primary and secondary headache so that they can get it right and provide patients with treatment that is appropriate to the diagnosis. We realize, we acknowledge all the difficulty in you taking the amount of time that is needed to diagnose correctly migraine patients. It's not the first time we are trying it, but we can't imagine working and being successful in making a difference in the world of headache in in the world in the attempt to provide access or to widen access to headache medicine without primary care physician. It's just not going to work without you. So we are putting on you a huge amount of responsibility and expectation that you will become a part of the International Headache Society global mission to try to expand access to headache medicine all around the world and wherever communities and countries that you serve. Thanks.
Thank you so much for this important message. And now we move on, and it's my honor to present Shlomo Winker, who's president of WONCA Europe. Thank you so much for being here and talk about this project.
So thank you all, and especially great thanks to my colleague Mehmet Ungan that on behalf of WONCA Europe did all these projects with his team. I went through the materials and found them very interesting. In general, I would say that any common disease or any common situation or any common phenomena should be primarily treated by family doctors, because for every complaint or every syndrome, there are not enough specialists. The availability is usually not ideal, and they should focus on cases that had been sent by the family doctor for consultation, in unique cases, in patients that didn't pass the first few stages of treatment, if there is a question about the differential diagnosis, etc. And I think that it is good for both parties that each discipline will treat the patients in their own discipline, which I mean, the most common patients of headache should be treated by family doctors, and the special cases and where the differential diagnosis or where conventional treatment is not enough should be moved to the specialists. I will open the session also with a few words about WONCA, which is quite a peculiar name. And I would say that WONCA is the World Organization of Family Doctors. And the acronym came from the World Organization of National Colleges, Academies, and Academic Associations of General Practitioners and Family Physicians. Our organization shortly is World Organization of Family Doctors. We have the World Organization, and also we have branches along the continents that are according to the WHO regions. So we are European region in the terms of WHO regions. Our mission is to improve the quality of life of the people, to foster and maintain high standards of care in general practice and family medicine, to promote personal, comprehensive, and continuing care for the individual in the context of the family and community, and to encourage and support the development of academic organizations of general practitioners and family physicians. We are an organization of organizations, and we altogether have 47 member countries around Europe, and also 14 special interest groups and networks that are working beside us around Europe. The member organizations are altogether have more than 100,000 members. And so as WONCA, we are looking for cooperation with other scientific organizations, and I found this cooperation quite productive, and I wish us all a very successful webinar this time, and also a very successful teaching modules. Thank you.
Thank you so much for this. And I'll just kindly remind those who are participating that if you have any questions regarding this course and other questions in general, then please write to the Q&A section, and then we'll have a session after the talks where we'll answer your questions. So moving back to IHS, now it's my pleasure to introduce to you President-elect Mario Perez from Brazil, and he will become president next year when we'll have the International Headache Society Conference, which is going to be held in Brazil, in Sao Paulo, which I hope many of you would like to join. So thank you so much, Mario Perez, for being here and giving your perspective on this. Thank you so much for being here.
Thanks, Henrik. Thank you for having me. Thanks for everybody that worked really hard on this initiative. It is a landmark, I think, you know, highlighting WONCA and IHS working together for the good of headache people, headache patients, as Dr. Burstein stated. The initiative of, you know, delivering better care, better medications, better approaches to diagnosis and treatment. This is very, very important, and we know there is some neurophobia where, you know, medical students or even general practitioners are kind of afraid of neurology because it seems too complicated. But in the end, our job is to make things clear in a way that, you know, in the complexity of the disorder, but in a way that people get good primary care and physicians get good knowledge about it. So it's really a great job that INUR is doing. The educational content is really good. This is the start of the initiative, and you know, a lot more I think we could and should do. It is important also to make other chapters of WONCA participate in and liaison with our national headache societies like Brazil or any of our almost 60 national headache societies we have so far in IHS, and we are growing very fast. Of course, migraine disorders are very common and debilitating conditions. Just highlighting that the GBD data has just been published in the Lancet Neurology, stating that migraine is ranked first, second, or third, depending on the country. Like Western Europe is the first disabled condition, more than stroke, and the same for Australia. Many regions, migraine is the second disease, and you know, some other countries the third. So this is just migraine, not to mention headaches in general as a complaint. There is a difficult job of sorting out what is secondary headache, what is primary, and what to do. So I think it's our job to approach and work together with family physicians worldwide. We face a very unequal medical access worldwide, and this initiative has to be tailored according to several in a particular region. So I'm really happy to you know, being part of it and seeing what is starting here. I think the future is very promising, but there is a lot of work to do. So we have to really, you know, bond and work together and think the next paths to consolidate a better care to headache patients. Thank you very much for, again, everybody involved in this initiative. And I'll be happy to work and improve this, not only now, and of course, Dr. Burstein is also approving this, but in my term, certainly I'll do my best to improve and make it better and bigger. Thank you very much.
Thank you so much, Mario. And now it's my honor to present Mehmet Ungan, and I'd also like to thank him so much for this huge task of creating a course like this. It is something that has been planned for some time, and this is something that takes a while to create. But Mehmet, together with Ainur and the rest of the WONCA team, has really been a force of power in making this possible. So thank you so much for being here, and I look forward to your talk.
Thank you. It was always a pleasure to work with Ainur, because she's really creative and a leader, personality. And even if I tried to be a little bit lazy at the beginning, she didn't let me to be lazy, and we worked together in a harmony. As a group work, as a team work, it is always possible to achieve, and I hope that we will be achieving at the end of some time, to see that my colleagues in WONCA Europe will be participating into this valuable course, increasing their practice skills and also the knowledge on it. Because this is a frequent reason, as you said, in the primary care, and the coding systems putting headache code at the top diagnostic or encounter reasons. However, the condition is underdiagnosed and undertreated. Sometimes it is claimed that it is overdiagnosed and overtrained, but it is not, because we can't diagnose very well. We just code it headache or pain, something like this, when you go in detail of the codings. One reason for the underdiagnosis is usually mentioned by my colleagues in family practice as fear or hesitation, and the lack of specific training on headache in the primary care. So the lack of the practical guidelines which are created in the primary care for the primary care doctors is another real reason, because they cannot be so practical sometimes. We know that more than 65% of the time of a patient, if you consider a headache patient, it is 65 of the GPs are spending more time comparing with the other diagnoses. So it means that there is a real time loss when the headache problem comes in the general practice in front of a GP. And if you consider that only 35 use an international classification, 35% can use an international classification, the rest cannot. So that is also making the things difficult in primary care. When looking at literature, less than 70% of the family doctors reported a high or very high interest in headache, and 75% wish to receive further training on the condition, theoretical and practical courses, and update lectures, and they are regarded as the most useful tools for the GPs. So that was the idea that brought this collaboration into practice with Ainur and with you all, IHS. As a conclusion, I think I have to mention to my colleagues especially that we are saying always in our values and in our skills, we are practicing evidence-based. We are using the resources correctly on behalf of our patients. We do comprehensive and biopsychosocial approach, and we are proud of it to make a patient-centered or people-centered care. So if you consider those, each item, and I will not go in detail, don't be afraid of it, but just I have to remind you that I think this course is taking all of those specifications, and it's in line with our principles in the primary care. I really thank you as IHS, and I want to warn you that general practitioners are really needing reliable resources and very good guidelines, practical guidelines, and good knowledge, good quality knowledge in order to practice easily not to go in deep, but take the ready good knowledge into their practice. That is very important course. I strongly recommend my colleagues to go in detail of this course and finalize and get that very good certificate. I did it already, and you have to do that also. Thank you.
Thank you so much, Mehmet Ungan, for this very important message. And I am now happy to introduce Aynur Özke. Aynur, if it wasn't for you, we wouldn't have this webinar today, and we would not be able to have this course. You have been driving it, and you've done an excellent job, and I congratulate you on it. And thank you so much for being here today and telling us about this course.
It's a very nice moment to me, and thank you for everyone. First of all, I like to thank the IHS board in the person of our then President, Professor Cristina Tasarelli, and current President, Professor Rami Borstein, who supported me with all its might when I shared an idea. Likewise, the executive board of WONCA Europe, Professor Mehmet, welcomed the issue, and we completed the content step by step together in a long working process. I had an experience that was very useful for me to learn the best perspective of family physician colleagues. I would like to thank Neil, Mehmet, and Henrik for their valuable contribution in the process. At this point, we have three models. The first one is about how to proceed when the patients come to the family physician outpatient clinics or emergency department with the primary complaint of headache. We have created a content that guides the way without drowning in details as much as we can. For comprehensive information, we cited the IHS Learning Center as a search. We repeated the 5 questions given before this model after the almost 10 minutes video and wanted to measure the benefit of education in our colleagues. Attendees with more than 70% success passed to the second model. In this model, we focus on secondary headache disorders, some of which are life-threatening, where headache is a concomitant complaint in this case. Our colleagues who are successful in the same way move on the third model. In this model, we summarize our treatment approach to primary headache, which constitute the largest part of headache disorders with a special focus on migraine, as previously mentioned that. We wanted to increase the contribution of our colleagues to their patients with up-to-date information. We offer our colleagues who successfully complete all models to opportunity to receive and use a certificate signed by both associations. After all, this is a living system, and it is possible to improve it, increase the model, and make all kinds of change as it used and feedback received. I would like to thank everyone who contributed, and I wish with all my heart that it will be useful for our colleagues. Thank you.
Thank you so much, Aynur. Great presentation, and I can see that there are already some questions in the chat, and we'll go through them. And you're also very welcome to write questions in the Q&A, also just general questions about headache treatment, because now you have a good opportunity. You have headache experts like Rami, Mario, and Aynur, who will be happy to answer questions. And now we move on to Neil Tikin, who has also been a very important part of this project. It has been great collaborating with you and making this possible. So thank you so much for being here, and I look forward to your talk.
Thank you, Henrik. First of all, I'm very excited to be a unique and special panel prepared in cooperation with IHS and WONCA Europe. So I want to share preliminary results of the model educational materials in family physicians aspects. So training models after the preliminary announcement before this launch, we notice some family physician also has completed it. Initial feedback was received especially from the participants, of course, most of them from my country. In general, the feedback given for the headache training models for these trainings, which are included in our daily intensive practice by family physicians, the following issues are preliminary address that effective use of time, effective use of technology, being able to listen effectively. It is intended for family medicine practice, satisfaction of trainee, training results, especially a certificate, very important, are stated. In some feedbacks, thank you for training. It was very useful. It was great to be able to go back for test after the lesson, solve the questions many times, and listen to lessons fluently. The other one, the trainings were really well summarized in the form of short and to the point shots. It was an enjoyable training. Another one, of course, there were parts I missed from time to time because it was in English, but overall it was good. I would like to thank everyone who contributed. The course videos are educational, and it was nice to be supported with cases. Another one, I had difficulties with my English, but overall I was successful. It was prepared very well, but the second module was a bit complicated, but overall it was very good. Thank you for providing such a free opportunity because we don't need any pay. It was a training, it was easily accessible and did not take much time. Time is important. Documentation with the certificate was encouraging. Our first results, since the announcements have just started, we have received feedback mostly from our country, but I believe that subsequent trainings can be improved with different feedback that we can reach from all over Europe after this introductory meeting. I think so. So thank you so much for this all of efforts. Thank you.
Thank you so much. That was very interesting to hear, and it is important to get feedback. And when you take the course, you can also write to the Learning Center giving us feedback. And I hope we can gather some data in the upcoming months on how many are taking the course and from which countries they come from. I think that would be very interesting to see. So now's the time for if anyone has some questions. I can see in the chat that there has been a question from one of our colleagues whether you have to be an IHS member to take this course, and it is not necessary. You're welcome to become an IHS member, but it's not needed. So you can just enter the IHS webpage without logging in as a member. In the chat, I have sent you a link to it, and I think that link is also being distributed via WONCA. And the password is just WONCA, so that is very easy. So all of you are able to take this course. So in the Q&A, I think this is also a comment from Tunkai Alwa about the hardship questionnaire, which is something that Professor Tim Steiner created, and it has been translated into different languages, and it's a battery related to headache diagnosis, quality of life. So that is, of course, an important tool, and I think that is something that is important to try to develop, to try to give family doctors tools in not just diagnosing patients, but also in following patient over time to see how well they respond to treatment. Okay, I can see in the chat from Ale Ortak if there'll be any upcoming events. Well, I hope, and as has also been said, this is a first step in the collaboration between WONCA and IHS. I think it would be great to have some other activities. This is a first step, and we'll of course keep you updated on this if you're a WONCA member or an IHS member. And there's one who's asking about, the same one is asking about whether you can become an IHS member, and you just need to go into the IHS web page and apply, and so that is my answers. Let me just check if there are any other questions. Otherwise, you have the time now to ask a question. I could maybe ask you, Ainur, as you have created this course. I remember that there was something that we talked about along the course, and that was regarding medication. I believe we had some discussions on what kind of medication should we present in this course, and also interventions like giving cranial nerve blocks, because I think it can be difficult due to the fact that we don't necessarily have advanced migraine medication available for family doctors to prescribe, and there are many countries where these medications are not available for most. So I think you try to find a good balance on what is available in different regions around the world, and also interventions that are not expensive to do. And can you maybe talk a little bit about your thoughts behind that, finding the right balance in what we can actually offer our patients?
Actually, we should make a guideline, as mentioned before, the other collaborator of ours. We have to create another guideline to focusing the family physician. As you said before, Henrik and the other collaborators, we need to organize a region-based and educational-based some different options in this guideline. The first step is the realizing the cases. As mentioned in the Lancet paper, this is an important issue. And for example, for migraine, we have to explore it is more than a headache. It includes several components in the history, and a family physician have to be aware of this component, not just the headache part, premonitory phases and the postmonitory phases, oral phases, and the triggers, importance of the triggers, and also importance of the comorbidities. For example, why cases have a headache attack together with some atopic rhinosinusitis attacks. If these cases have to be contributed a case with rhinosinusitis related headache disorders or a migraine component, for example. It's a very common issue, and we have to be organize much more educational panels focusing these specific items, for example. Another issue is the tapered guideline and step-by-step materials have to give our dear family physician colleagues. Which step they have to be collaborate, which step they have to refer a cases to another secondary or tertiary center, for example. After that, I think this is the first step of our collaboration, and we are opened the very important door altogether. And then step by step, we should develop our own way, and regarding the feedback come from our colleagues in the area. And then we have to cooperate our next step for a while. I just take a note about the guideline to creating family physicians collaboration altogether. But otherwise, we should learn much more altogether.
All right. Maybe if I could ask questions to any of the WONCA representatives regarding the typical patients that you may see as a family doctor, because I can think of two categories. I can think of patients who come in and are afraid of having something serious like a brain tumor or something else, or it could be, as an example, a migraine patient that really suffers from migraine and have difficulties in functioning in the work life and social life. Is there like some typical patients that you see as family doctors, and are there any of these patients that you have that think are difficult to manage at the family doctor level? So if you have any input to that would be interesting.
Maybe I think the biggest problem in the minds are, having some kind of organic or inorganic brain problem, cranial problem could be behind. And then, but the advantage of the family doctors is the diagnosis is usually depending on time, because we have been knowing the patient for many years, and the patient's family and work environment and such kind of other triggering effects, like let's say, and then it's easier for us just to exclude a serious reason on behind. But still, we keep in our mind if the onset is totally different than the previous headaches, let's say, so if such kind of patients are not easy to. I can't remember one patient to tell it to right now, but maybe Neil can have some. Do you have anyone in your mind to tell us, Neil? But I think most probably is any space occupying lesion, or having a kind of other problem other than migraine usually is the worry of the family doctors.
Actually, maybe the issue is not the adult issue. For example, in the younger children, it's another complex issue for the differential diagnosis and the comprehensive evaluation. Or in the same time, other side, elderly patients is another problem in the evaluation of the secondary causes. Sometimes stigmatization creates another problem each of us, and also judging the cases another issue. For this reason, I think that this is a very big scan, and we have to of course focus on the main topic, but then we have to take back one step, and we have to see whole of the pictures. Otherwise we can skip some of the details, and we need to each other, I guess. We need to each other to understand more and coping with this big issue.
I think it's another big problem. Headache is isn't generally the patients cannot realize this is a problem because headache is common. So headache is so frequently, so many times they never they don't give any history about headache. So in daily routine practice, sometimes we need to ask, have you got any headache? Because some problems also are related with headache. But headache is health behavior is also very important. So we have to ask and give some solution to the patients because they think that there are no solutions. So this is a painkiller is a common to solve this problem. So they generally don't any information about headache. So I think it's a big issue for primary care.
All right, good. Thank you for great answers. And I think that unless there are other comments or questions, I think we'll now end this webinar. So this is a start of hopefully a great collaboration between the IHS and WONCA. I would like to thank everyone for participating. I can't see, sorry, I was just about to wrap up, but now I see there's actually one question coming in, so maybe we'll just take that. So this is from Irma. I would like to ask, a headache diary is an important aspect in headache monitoring. How do you encourage the use of headache diary in primary care? Is there anyone who'd like to comment on this?
Maybe we can start and their experiences of the WONCA side they can add. Thank you for this very important question, Ima, because headache is a subjective feeling. We have to convert the subjective feelings in an objective way. We don't have any clear and usable and sustainable biomarker until now. For this reason, the only biomarker of ours is the qualified headache diary as much as possible. And we always encourage our cases to filling the any diary in paper-based diary or the electronic diary, doesn't matter, but any diary. For example, the control visit cases to come to me. Yes, I have almost headache again. Yes, okay. Please give me your diary, and in this time I can see that previous month she had, for example, 20 days with headache, and 3 of them is severe attack. But now she had, for example, 5 days with headache and 1 severe attack. In this case, we can show the patient, yes, you are right, you still have a headache attack, but now we have a prominent decrease your attack frequency and important decrease in your attack severity and the duration as well. And if you follow up our regimens and our management rules, and finally you will have less attack frequency and less severity of attacks, and for a while less burden in your quality of life. It is a way for getting in contact with our cases, and a very important way. And in our daily practice, we are encouraging each of our cases taking a note in their diaries. I have no idea what is your side in the WONCA, and family physician have a practice with the headache diaries. Should we develop some more with the family physician focusing?
I know approximately no one who is keeping the diary for the headache diarrhea, because this is something I think that should be the GP should get used to use it, you know. So not many are happy to use such kind of, you know, tools. But on the other hand, of course, in the training, they learn it. This is important. Maybe such kind of courses, this kind of courses, can make it a little bit more clear how to use it and how to interpret it, you know, and how to collaborate with the patient on the diagnostic pathway, let's say, together. So thank you for reminding us, you know, this is an important point. Am I wrong? You know, not many are using it right now, as I see in the family practice, right? Yeah.
Yeah, I think so.
Shlomo? No, maybe. Okay. So this is it from our side, let's say.
Yeah.
I can say from my perspective, we use headache calendars quite a lot to try to document if patients respond to treatment. But of course, to introduce a headache calendar or diary to a patient, it's also very important to explain to them the rationale, and they have to be motivated and see the point in writing a headache calendar. So to try to see any response to treatment, or maybe for them to see some sort of pattern in their headache, I think that's important to talk to them before just handing out a headache calendar and demanding it to be fulfilled by the patient. So that was just my short input. And well, I think with that was the last question. So thank you so much for spending time with us, and thank you so much for those who are involved in this creation of a WONCA IHS headache course. I look forward to future projects, and have a great day. Bye, everyone.
Thank you. Bye-bye.
Thank
you. Bye-bye.
Bye. Thank you.
Bye bye.
Bye.